launch the key performance indicators for environmental health.
The Ministry of Health has launched key performance indicators for environmental health workers in local governments to enhance the performance of environmental health cadres for their role in disease prevention and health promotion. Permanent Secretary at the Ministry of Health, Dr. Atwine, says certain environmental health service delivery remains unsatisfactory, resulting in a big burden of disease in the country.
We don't see the function of health inspection creating impact in hygiene, in sanitation, in our environment, pollution, waste management, garbage is everywhere. People are cooking food everywhere. People are not tested. It is a requirement. If you are going to be a food vendor, one of the requirements as per Public Health Act, you must be checked. Your people must continually undergo regular checkup, because you are handling food, and if you are sick, if you have typhoid, if you have any infection, you pass it on to other people you are serving. So these are things that we want, not just to come up with a target as Ministry of Health, or we've developed key performance indicators, now we tick the box. No, we want these performance indicators to be used by the people who are who are given the job. We want them to use this as the guide, and also in reporting, follow up on issues in the community. If the problem is latrine coverage, then though the leaders in that area must be concerned.
So that means we need to work on our hygiene, water, sanitation, and hygiene. We can reduce these diseases drastically if we live responsible lives, because we also have diseases of lifestyle.
Health experts attribute recent outbreaks with direct link to the health of the population, animals, and socio-economic system, calling for the need to focus on preventive healthcare services. Preventable ailments still account for over 75% of the country's disease burden, with the main drivers being limited access to safe water, sanitation, and hygiene, among others.
Up to 2024, there were 230,000 people who got sick because of cholera. 4,100 people died because of cholera. And the countries most affected were the East African region: Malawi, Zambia, Zimbabwe, Kenya, Mozambique, and even most recently, Uganda in Kampala, Elgon region. So your work matters. So as I conclude, think about how many lives would start for us to be able to effectively prevent disease outbreaks. You have to prep and stop them at source.
Zahara Abigawa, UBC News.